it's Dr. Jackson over at the Sports Pod, and today I'd like to continue my little mini-series on basketball-related injuries, and today I'd like to continue my focus on the knee. So if you are a fantasy basketball player or you keep up with NBA basketball, you might know that just recently, within the past few days, Jabari Parker tore his ACL. So that's very unfortunate. He's had an injury, a knee injury, I believe an ACL injury in the past, and now he's hurt again. So for me personally, as a doctor, I hate to see these types of injuries to athletes or just anyone in general, but a little bit of a special spot for me is the fact that he's on my fantasy team. He was doing really well for me, and now unfortunately I have a major producer on our team that's gone, so I'm a little bit greedy, a little bit selfish on that standpoint. But hey, Jabari Parker, if for some reason you're watching this video, man, I hope you the best of luck. I hope you recover really quickly. Also, my sentiments to Zach LaVine, two-time reigning dunk champion. He just tore his ACL I think about a week ago, so shout out to him. I hope he gets well. But I'd like to talk a little bit about the anatomy of the knee and the mechanism of injury behind an ACL sprain, strain, or a tear itself. So the ACL is a small ligament in the knee. It attaches to your tibia, which is your shin bone, and then it also attaches to your femur, which is your thigh bone. So the knee is what we call a hinge joint. So you have your thigh bone or your femur, your shin bone down here, your tibia, and it pretty much just hinges like this. So there is a little bit of rotational movement in there, albeit it's not that much. And the ACL is one of the ligaments that actually keeps the tibia from just shooting forward from the femur. So it keeps that movement in check. Also, some other muscles that attach to the knee that kind of prevent that from happening and keep that movement, whether it be extreme flexion or extreme extension, is going to be your quads and your hamstrings. So oftentimes, if you have a knee injury, whether it be an ACL injury or a meniscal tear or something along those lines, part of your rehab is going to be directed at restoring proper strength of your quads and your hamstrings. So you don't want the quads too strong and the hamstrings too weak, or vice versa. You want them roughly the same strength, and that way one muscle group is not pulling more so than the other, putting the knee in a very risky position. So how do you get an ACL injury? I've kind of alluded to this a little bit, but essentially an ACL injury happens when you have some degree of rotation and then either hyperextension or a valgus stress to the knee, which means a force that pushes your knee inwards. Oftentimes when the knee kind of goes into that inward or knock knee presentation, you overstress not only the medial collateral ligament on your knee, but also the ACL, and then it's just a little bit of rotation in there, or maybe a little bit of hyperextension, and boom, the ACL goes. So that's essentially the mechanism of injuries behind an ACL tear. So if you play basketball, or have ever watched basketball, you can see why it's a very common sport to see ACL injuries. There's a lot of jumping. There's a lot of cutting, twisting, turning, and this just puts a lot of stress on the knee. And then eventually at some point, you may have an injury. Now, I did allude to this previously, or just a little bit earlier in my video. Jabari Parker had a previous knee injury. Well, one of the biggest predictors of whether or not you're going to have an ACL injury would be if you've had, a previous ACL injury in the past, and then that tells you right there, like, hey, look, I need to for sure be on top of my rehab because I'm at a higher risk for a future injury to my ACL or just my knee in general. So that's pretty much it, guys. If you're feeling like you've got a little bit of pain or discomfort in your knee, maybe you're walking and you feel like your knee gives out, or you notice that it's just not as stable as you'd like it to be, or you're losing some power and you're jumping, maybe it's painful if you cut, go ahead and reach out to me. You can call me, you can text me at 214-862-1469, or you can shoot me an email at thesportspoddallas@gmail.com. I hope to hear from you guys soon. Thanks so much, and move free.